Hello, everybody. My name is Atiro Hill, Senior Health Educator, and welcome to the Real Talk Podcast. I'm honored to have our first episode with our guest, Dr. Jorge Ramallo.
Nice to be here. Thank you for the invitation. I'm excited to be here.
Of course, of course. He is very prestigious. I'm going to sound off some of his accomplishments, some of his many accomplishments, and then we'll get a go on. So, Dr. Jorge Romelo, he is a primary care physician, board certified in internal medicine and pediatrics. He obtained his MD and MPH degrees from Yale School of Medicine in 2014. He completed his medicine pediatrics residency at the University of Illinois, Chicago, where he also served as chief resident. Also, Dr. Ramello joined the Inova Health System in 2021 and helped establish Inova Pride Clinic, the first LGBTQ primary care clinic in Northern Virginia. So that's incredible, where he now serves as its medical director. He also was appointed as assistant professor of medicine at the University of Virginia, and he teaches residents and medical students in his practice. Incredible. And also his clinical interests includes LGBTQ healthcare, gender affirming care, high quality primary care, and obesity management, adolescent medicine, HIV primary care, and preventative health. Incredible. Yes, yeah.
Thank you. Yeah. It's a long list. I need to narrow down my interest. I think one of the big things is that the LGBTQ plus population just needed a home, and that's what we created. The bottom line, that's really why the clinic was created initially.
Of course, it's really big, especially, in the area, especially I sometimes deal with clients that when they're going through something, they want to go to urgent care or other primary care places, and they say that sometimes they don't have the best experiences because, oftentimes doctors, they're not always trained on how to engage with different kind of communities. So it's really great that you and the team figured a way on how to make a safe space for them.
Yeah, that's what we tried to do.
Yeah, for sure. And then I had some fun questions I just wanted to start everything off with. One question, what's the thing you like most about your profession?
I love seeing patients longitudinally, meaning that I get to see them multiple times. I get to meet them, know their stories, know their backgrounds, and be part of their family, be part of the community that's helping them. So I really enjoy that. I like to get to know people. I like to get to know my patients in an intimate way, knowing where they've been, what their goals and aspirations are, celebrate the victories, be there for them when they are actually down or something bad happens, and just try to help a lending hand. So that's honestly my favorite part of the whole thing. That's why I love primary care.
Yeah, of course, staying in tune with your clients, kind of seeing them develop, helping them, advocate for themselves, grow with them. Yeah, I see it's kind of like the village, being a part of their village. And now, final little question to get to know you a little bit more. What is your favorite music genre and why?
Oh, Latin pop, love it.
Okay.
I grew up with it. I was in Latin America, and I think it just continued to grow as I moved to the States. So I really, really love that. So that's my husband and I would just listen to that all day long. So we love that.
Awesome. Another question. Who's your favorite artist from Latin pop?
Oh my gosh, love Shakira,
Shakira,
Maluma. We went to his concert. I mean, it was just incredible. So yeah, all about that.
Awesome. I believe they made a beautiful statue of Shakira in her country. Yeah, I believe in Colombia. They made a huge statue of her in one of her dancing poses recently.
I didn't know that.
Right.
Well, I should go check it out.
Yeah, it's cool. All right. So, Mpox is a huge epidemic right now. It started, they said it, really trickled here in America last summer, and then a lot of news stations haven't followed up with it. So a lot of people are thinking, oh, well, it's no longer relevant. So, I definitely wanted to ask some questions pertaining to Mpox, your expertise, and the communities that is affected. And the first question I want to ask you is, what is Mpox exactly?
Sure. So Mpox, previously known as monkeypox, so people know. Now we call it Mpox. It's a much nicer term, I think.
Yeah.
It's a virus. It's a virus that's very similar to smallpox, but not as contagious or as fatal. It's something that originated in Africa, and it's something that can be easily transmitted from human to human in specific scenarios. Typically, it's not as contagious, but this specific type of virus just kind of mutated, and it just found the right environment to be able to spread throughout the globe. So in 2023, what happened was we ended up having a spike in cases all throughout Europe and then other parts of the world, and then sure enough, it came to America. And in the United States, it actually took hold in the gay and LGBTQ plus population centers such as New York, San Francisco, DC.
Oh, wow.
So it just continued to spread. And we'll get into this, but like the reason it came to spread was because there were specific ways in which people can get infected with it. So at the end of the day, Mpox is a virus. It's typically a virus that can cause specific set of symptoms.
Okay.
But it's typically not a fatal virus, but it's something that can definitely cause a lot of issues for people.
Okay. Wow. So, is Mpox linked to any fatalities? Can it be fatal?
It can. So there's specific types or groups of people that actually can have this infection and actually it can be very dangerous. Specifically people that are HIV positive and people that are not well controlled with their virus, people that are immunocompromised, say a transplant recipient that is on medications that decreases their immunity. So if they get this type of infection, it can definitely spread throughout their body and can cause fatalities. In Virginia, we had about 500 cases at the peak of the epidemic. And out of all of those people that were infected, we had a total of 2 deaths.
Oh, wow. Okay. Wow. And those 2 deaths were linked to people with immunocompromised conditions?
That's correct. Unfortunately, that was the case. One of them was a person with HIV that was undiagnosed, and it just continued to progress from there, unfortunately.
Okay, wow. What are some symptoms or early signs of Mpox?
So it's interesting because it can present in a very wide number of symptoms, so we always have to be vigilant. The classical one we've heard about is like the development of this rash, which is a little pustule, like a little red dot that actually appears in different areas, usually the area that was exposed. So for people that are having say anal sex, for example, some people have noticed that in their genitalia or in the anal region, and these lesions tend to be red, raised. They tend to be very painful, actually. So they come in little clusters. A lot of people think it's kind of herpes or something like that, but in reality, if it's something that is actually persistent and it fits the criteria, it could be Mpox. That's why people have to be very vigilant about that. The other symptoms people can have can be very broad. Fever, malaise, you're not feeling great, you're feeling weak and just almost like a bad cold. But if you're having those types of symptoms, sometimes those come first and then you end up having the rash that accompanies that. So it can come one or the other. Typically the rash is the first thing that appears.
Oh, wow. So it's no set like way the symptoms come in, it can come in either or. Bumps or feeling very sick. Okay.
Exactly.
I had a client one time ask questions about if a rash or discoloration was related to Mpox. So can the Mpox bumps or rashes, can that mimic other things like eczema or other kind of conditions?
So it can. It's very difficult to tell, especially for somebody that's not a doctor or a dermatologist. Like any rash is going to look weird and concerning, and we have to evaluate, right? So it also depends on the set of risk factors, we call them, right? So if you happen to have had contact with somebody that was diagnosed with Mpox and now you have a rash, then your risk is definitely much higher and it should be evaluated. But if it's just a random rash and you have a history of eczema and this looks like your eczema, most likely it's eczema. The one thing that usually can tell you whether this is something different is the presence of pain. Because pain is usually one of those symptoms that typically is present that other rashes don't have. They can be itchy, they can be a little uncomfortable, but not as painful. So that's one of the clues, but it's not 100%. I usually tell people in medicine, there's never absolutes. There's not 100% or 0%. There's always probability. So if there's pain, the probability that it's something like this, especially if you were exposed to somebody, is greater than if you were not.
Okay. Wow. Oh, well, thank you for sharing a lot of that information. Another thing is when it comes to if someone does develop Mpox, is there any procedures that they would have to go through? Would they have to like quarantine, or how would they go about treatment options?
So the first thing is to ask for help. So typically the health departments in each state and county have been very aware of this and very useful in getting people the help they need where they need it. We are lucky that in Northern Virginia we actually have several health systems that are very well equipped to be able to evaluate somebody that may have Mpox and test them right away. and we have developed the systems to be able to do that testing in multiple places. But
Okay.
the first step is to ask for help and find somebody that can see you and test you. Okay,
Okay.
especially if you have that specific concern. You're like, wow, I know somebody that had Mpox and now I have these symptoms. That obviously raises a lot of concerns and it has to be evaluated properly. So seek help is number one.
Okay.
Number two is that obviously if you have a concerning rash or a symptom and you're concerned about this, make sure that you isolate yourself and you're not exposing other people that could become infected, right? So number one is cease all sexual activity. That should go without saying,
Yeah.
but sometimes we have to remind people, like we should definitely, if you have any doubt in your mind, you don't want to give it to other people, just take a break until we figure this out.
Okay.
There is a small risk that this can be transmitted via the airways. So that is the reason why we often told people with confirmed diagnoses to stay in their rooms, try to isolate themselves, kind of like we would do with COVID infections, right? The risk is not as great. The greatest risk comes from direct contact to the rash or the lesions or the liquid in that rash. That's the main way in which people actually get it, and that is why the main way of contracting is through sexual contact. So again, if you're prioritizing not touching other people or like allowing other people to be exposed to that rash in that specific area, that should be your priority while we figure everything out. You ask about like what else other options. So if this is a positive, usually the treatment that is recommended is close monitoring with a clinician. So usually they point you to the right direction. And most people don't need any treatment. This is something that over time self-resolves for most people. However, when there are severe cases that are really affecting a person's functioning, that's when we sometimes have to recur to those newer treatments that were approved by the FDA.
Okay.
But those are a little bit more difficult to get, and there's a specific set of criteria you have to meet.
Okay.
Which is why it's important to have somebody, a clinician, that is aware of Mpox and can actually get you the treatment you need if you need it.
All right. And so another question I wanted to ask is, so when it comes to the African American community, we are disproportionately affected by Mpox when it comes to fatalities and just the rises in cases. So what in particular does the health departments, or from what you see, how do they address that need in our community?
So I think that the fact that we have a higher incidence of cases in the African American community is just a testament to the inequities that we have in our healthcare system, unfortunately,
Yeah.
something that we're still dealing with to this day. And it just reflects the lack of access, the lack of effectiveness of our campaigns to inform the community about not only the Mpox epidemic, but also the options of getting vaccinated and getting those that are most at risk to actually be able to be protected. I think the health department is conscious of this, and they're trying to do as much outreach as they can to be able to tell people, hey, you're at risk. There's this awesome vaccine you can get for free. Please come by and get it. And just making that accessible has been the other issue, right? People work, people are busy. So like creating spaces where you can actually come in and get those is important. The vaccine is actually, it's pretty good. It's not 100%. No vaccine is. Before, I know that people were scared because like they were like getting them in their forearms,
Yeah.
and it was like a huge welt, and people didn't love that, which I understand. We just didn't have enough. Now we do. So now people are just getting them in their arm, and it's working beautifully. Usually, you have to get 2 vaccines 28 days apart, so it has to be 2 doses. If you only get 1, you have some protection, but it's only 30 to 60%. If you get 2, the protection is between 60 to 85%, so it's much, much better. Which is why it's important that anybody that started getting their vaccination gets their second shot. That's very, very important. But I think the more we can get this message out to the community to let them know, hey, if you're not vaccinated yet, you should get vaccinated, consider doing that. It is a safe vaccine. It is one that, like any vaccine, sometimes you can get a little bit of a negative side effect, just feeling a little sick for a day, things like that. But it's not one of those major ones that really makes you super sick. But I understand the hesitancy, and I understand all of those things. But at the same time, I think that people just need to hear it from trusted sources like Nova Salud, so that they know that we, as part of the community, we are recommending this because it is for our own good. I think that's so important. And that actually brings me to a question for you.
Of course.
And I'm curious to know what happens if a patient shows up to your doors and they are concerned they have monkeypox or they have a rash. What is your procedure?
Sure. So, prior to the Mpox flux, when it came to COVID, we, changed our office to meet, PPE, put up plexiglasses, and do things to, make sure that we're not spreading things through respiratory or things like that. We wear masks now. So if we do have a client that is experiencing what they perceive as Mpox or it is Mpox, we don't shun them away. We do have a protocol on how we will, guide them through the office in a very safe manner. So that way we can, sit with them, talk with them, figure out what's going on. We'll list down what their side effects or symptoms are. And then Gia, she's the SCI manager. She will usually instruct them, refer them out to one of our partners in Arlington, Alexandria, Fairfax to do further testing and treatment. And then, whoever the health educator is will stay on top, just like what you do in your profession, stay on top of their progress. The health educator, along with Gia, will stay on top of their progress, and anything else that we can do, we'll be able to do.
I love that. So that means that they'll be taken care of and they'll know where to go, which is so important.
Oh yes, definitely, because we just want to make sure that we create, just like with your Pride clinic, we want to make sure for us that we provide a safe space for our clients and let them know that, hey, no matter what you're going through, you're taken care of.
And do you offer the vaccine here?
So we actually, really great question. We do work with Arlington and Fairfax. Every once in a while, we will have free vaccination clinics from 4 to 7 p.m. I believe last time we had 60 vials.
Wow.
And the appointments, they can set it up or they can walk in anytime during those hours. We had our last one on February 1st. I will definitely reach out to Gia to see when we're having another one because we had a really big turnout.
Amazing.
So this concludes our first episode of the Real Talk podcast. Thank you so much, Dr. Ramallo, for your wonderful wisdom, and keep up the great work that you're doing in the community with the education and setting up the primary care clinic, to create a safe space. Mpox is something that disproportionately affects our communities, but as you've seen here today, there is a light at the end of the tunnel. There's a lot of different resources, whether you're living with Mpox or affected by Mpox, or if you want to prevent Mpox. So just stay abreast, educate yourself, spread the awareness, and together we'll end that just like we'll end many other epidemics. And Dr. Ramallo, is there anything you would like to end on?
I think that Mpox is just part of a bigger strategy for us to think about how to keep ourselves safe. So think about PrEP, think about DoxyPEP, think about getting vaccinated. All of those things are just so important for any member of our community to stay as healthy and safe as possible.
Thank you so much.